Friends, I'm Dr. Sanjay Pandey, consultant uro-andrologist at the Kokilamine Dhirubhai Ambani Hospital in Mumbai. Erectile dysfunction, a dysfunction which so much hampers the quality of life of a young male who actually is living in agony and anguish, discontent, desperation, and dilemma about a progressive change happening within himself, for which he is not able to discuss too, while he's progressing towards a chronic impotence or failure to get the erection that would make him capable in the bed. There's so much shrouded in difficulty about himself that he does not even discuss it. With close to 35% of India's population actually being that youth population, it is important for people to be able to come out of this and be able to talk about this. Improving conversations about the possibility of failing erections, failing quality of life, being a male is an important aspect that one needs to take it forward, which means conversations between partners to be able to sort out this and probably able to reach your andrologist in time in your cities. Conversation across the table with your andrologist in your cities to be able to move progressively upon the evaluation, upon the treatment arm is an important aspect that needs to be driven from this important platform today. There are so many factors which in today's youth could actually be triggering and probably progressing erectile dysfunction towards a chronic, close to a difficult state from which we need to repair them and treat them completely. So bring about dysfunction to function could only happen if you could increase your conversations, increase your awareness, and move on towards improving your quality of life. Therefore, the factors which are more commonly seen by me and by our colleagues who actually go through this phenomena regularly are diabetes mellitus, where uncontrolled and long-standing diabetes, which actually also happens to be an important aspect in today's quality of life issue, actually contributes a lot in India towards erectile dysfunction. Hypertension and antihypertensive drugs, therefore a requirement to treat your hypertension, is another contributing factor. And remember, diabetes and hypertension are important quality of life indicators in today's youth. Smoking, a chronic phenomena which brings about changes in the erectile tissue, compounds the whole aspect around, and therefore we look at no smoking as one more important aspect towards improving quality of life and maintaining penile health. While there are neurogenic conditions, injuries, traumas, accidents, there is also hyperlipidemia and lipid profile dysfunction, various kinds of vascular phenomena and vascular diseases, which all contribute to erectile dysfunction. It is told that erectile function is a barometer of man's heart and man's overall health. Therefore, in a man's health, to be able to not discuss this in a frank conversation with your doctor would actually miss out something which could progressively be increasing. In today's world, we have got the treatments available, which your doctor helps to move it forward to the highest possible level. An evaluation of the kind which starts with a wonderful interview or a friendship or interrogation across the table gives us a lead as to what are those aspects which we miss out many times. It's important, therefore, to be in a conversation to prevent this progressive impotence and halt it to a point in time and bring about a treatment. The treatment that brings you out of this agony and anguish that you're going through is something which has gone to the highest possible level in 2021. To make it a man's thing and to make it happen to the highest possible level, to be able to discuss this is an important option. That means the treatment options are decided based on your function, based on your capability, and it's taken up the ladder, right from a behavioral therapy on one aspect, looking at the pills, looking at vacuum erection devices or maybe injectables, are all treatments which is ingrained in the very algorithm of movement up the ladder on a cascade to help you to finally get treated. In 2021, while we're looking at treating erectile dysfunction, we're also looking at curing this impotence almost completely. For men who live in dilemma for a long time before they are brought about by their partners to an andrologist or they seek help with a loss of hesitation, I think it's important for andrologists like us to bring about a cure to a phenomena which has actually brought a difficulty into the whole quality of life and the morale and the capability. When we are looking at that kind of an aspect, I think it's extremely important for us to discuss the treatment options to the highest possible level that we've achieved. And to do that, chronic organic erectile dysfunction, which cannot be cured with medicines, and where the partnership is getting more and more difficult and disturbed. I think we have got this cure right now in terms of penile prosthesis. The penile processes of the new age malleable kinds which have arrived in India and kinds that we already have in terms of influences have actually helped us to move to the highest possible level. Friends, it is time for us to wake up to this dysfunction, which actually could bring about an impotence or erectile dysfunction to levels from where sometimes the cure gets very difficult. To pick it up early, to identify it amongst the partners, to reach your andrologist in your cities, and through this very strong platform that has been created for you, helps us to move to the next possible level. Treatment is possible, cure is possible. Then why not probably go and speak up to your doctor and take it forward? India should be having a no importance day from a national importance day. That means everybody should be capable of it in their youth and progressively continue to do better with the treatments available with all of us. Which necessarily means that in this era, it is time for us to look at talking about erectile dysfunction does not make you less of a man. You continue to be a man and a male. You are somebody who actually can take it to the highest possible level. On a very important occasion from the platform we speak today to you, it is important to convert the National Importance Day to a No Importance Day to make everybody capable and bring them out of agony, anguish, dilemma, discontent, and finally the desperation they go through. Importance is clearly treatable, and it's treatable only when you take the first step. So while living this silent issue and menace, which is plaguing you completely, physically, that you continue to progress yourself, it is time for you to take it to the highest possible level. Get your importance corrected and treated, and finally be a cured male who's capable in bed. Thank you so much.